plus this cocktail of drugs. And were they feeding her during these 4 days that she was there?
Yeah, that's a great question. So, I mean, you're you're doing a great job. I'm a man, so I only can do one thing at a time, Naomi. So you brought up so many things. I got to comment on them now. Were they feeding her? So that is actually one of the reasons that I was taken out. So I was not physically removed. It was an armed guard that escorted me out, but it wasn't that he had. I wasn't in handcuffs. I just want to make the record correct.
Okay. It's
Anyway,
bad enough, but go ahead.
yeah, but I mean, they threatened to call the Appleton Police Department if I didn't leave immediately. So I mean, I was between a rock and a hard place, and I called an attorney friend of mine, and he suggested leaving, so I did leave. But anyway, the incident that got it to that point was I was challenging them to feed Grace, and I told them we can feed Grace. I know how to feed her because Grace, of course, could feed herself, but now with a BiPAP. Well, they would come in, the staff would come in and clean her mouth, swab her mouth for moisture and everything, and a couple times a day. And they would remove the BiPAP, put her on a low flow cannula for a while, and it worked fine. I said, that's all we need to do to feed Grace. And the nurse got into an argument with me, said the doctor will never approve that. And I told her bluntly, I said, I am in charge of my daughter's care, not the doctor. Right. And ultimately that led to me being escorted out. You mentioned something else that I want to comment on because it's maybe the most important thing. I don't want to be taking credit for this. I mean, God led me into this, and my background is interesting in that my background is as a CPA. I'm normally used to audit trails. I started researching, started digging. What I found is the single most important thing that people need to be awake of with the medical system in our country, which is the Center for Medicare and Medicaid Services controls healthcare through reimbursement rates. Mm-hmm. And they do that illegally. They're violating what's called the state actor doctrine. So these hospitals, the doctors, et cetera, their reimbursement rates are based on the entire patient population following what they call standards of care. Yeah. And it's not just if you're on Medicare or Medicaid. So they will reduce your reimbursement rates if you don't push the patients to follow standards of care. My wife is with a lady in the hospital right now, and they keep doing this. They want her to go on the statin. It's just a constant barrage of pushing these meds without disclosure of the reimbursement policies, without disclosure of how much they're getting paid for this. On top of that, what they're doing is these doctors, if they have a 16-minute conversation with a patient about end of life, so to get a DNR on their chart, they get paid $94 from Medicare just to have that discussion. This is completely demonic, what is going on.
Oh my Lord. That is completely demonic. And if your daughter was having respiratory distress, what possible medical reason could they have given for not feeding her? I mean, your body needs energy to fight an infection. Did they tell you why they weren't feeding her? I should disclose, and maybe I shared this when we last spoke, this partly comes from my having almost died in the hospital. Thank God I didn't, but it was a very systematic, it had some very real parallels with what your poor daughter went through, which is they wouldn't feed me. They wouldn't let Brian in. They wouldn't let me intervene. They kept delaying my life-saving procedure because of, the power went out. Allegedly, they delayed it for 3 days. They weren't giving me water. And then they were saying, oh, don't worry, we'll put her on a respirator. And they were giving me drugs that were depressing my heart rate and so on. So I think that I know that this is systemic, but I guess what I want to also ask is, I want to ask what medical reason were they giving for not feeding her? But the other thing I wanted to say is, and I'm just like sharing, right? Because I know that you're onto something massive and demonic and systemic. There is no, up the chain of command, I couldn't find the source of it could be an algorithm, here's a healthy young woman with Down syndrome. Here's a dissident, right? Here's someone who questions the medical system. You don't know what the algorithm is saying, but what I experienced in the hospital was that the nurses weren't accountable to, like they were getting direction on their little, algorithm device. The doctor didn't come see me, but the doctor wasn't accountable. And if you've got an algorithm doing all of this, which AI can now do, they can kill you without anyone being guilty of the murder, right? Just through the protocols or just through the algorithm, honestly, pushing some kinds of care further and further away so the human body can't support it. That I just wanted to share that. So what did they say to you about why you couldn't feed your daughter?
Well, they use the excuse is that she's on the BiPAP. So what happened, interestingly, the last day, Grace's last day on Earth, we had a call with the doctor that morning. He said, Grace had another good day yesterday. We should work on nutrition. This is her last day. While we were on the call, the nurse increased the Precedex to the maximum allowable dose. So he says, Grace is such a good day, we should work on nutrition. So then he went through a discussion of a feeding tube. So my wife and I approved a feeding tube based on that discussion.
Wait,
He said, we need to get.
Was there for 4 days with no feeding tube?
Well, I was feeding her from the 7th, 8th, and 9th when I was in the room with her. So I was physically feeding her. I was ordering food from the cafeteria and, helping her eat.
But the hospital was not giving her any nutrition for those days?
The hospital was not, correct. Yeah. I didn't even see that as nefarious as you do. But, the reason I see it as nefarious now is because of how it got laid into her last day. So we approved that feeding tube based on the prognosis. The doctor said, we need to get Grace's bowels moving, get her out of bed today so she can be home in the next several days. So we approved the feeding tube based on that prognosis. Well,
wow. I wish I'd started investing in gold 10 years ago. There's no time too late or too soon to invest in gold. What if the next big crash is already in motion and almost no one sees it coming? Got to think about that. Every major economic collapse since 1929 was preceded by the same 7 warning signals. Right now, all 7 are flashing red. These are not headlines. They are deep market indicators that Wall Street prefers you never to hear about, because Wall Street doesn't want you to know what Wall Street knows. That's why our friends at American Alternative Assets created the Bellwether Signal. And this is a free report that reveals what these signals mean and how smart Americans are protecting their savings with buying gold and silver before it's too late. So important. So download your free copy at cloutgold.com, or call the company at 1-855-803-GOLD. That's 855-803-4653, 855-803-4653. You should really get the facts to protect your future, and don't wait for the headlines to catch you off guard. Honestly, gold has gone up and up and up so much, and silver is rising, and there's so much instability in this world. I'm so relieved that we're able to invest in gold, our, little nest egg. We don't want it to be at risk. So it's wonderful to have American Alternative Assets as a trusted source for gold investment and silver investment.
When the nurse inserted the feeding tube, consistent with doing that at about 11:30, 5 minutes before she put her on the first dose of lorazepam, with the excuse was, Grace is already sedated at the maximum allowable dose of Precedex. Oh, we got to add lorazepam so that she doesn't have a reaction to this feeding tube going down her nose. It is. When you put the pieces together, it's hard for me to stomach my best buddy sitting there and how they did this to her. But, praise God, we have this platform to be able to get this message out to other people. The systemic piece where you're talking about AI, what's interesting now, I don't like to focus on COVID, because then it's like we turn the page or turn the chapter, because this is way bigger than COVID. With the COVID protocols, they had the PrEP Act as their immunity from liability, but they have this standards of care, which a lot of them, as you mentioned, are AI. That's their real immunity from liability, and that's been happening since the early 80s. So this has been a long process that the they have immunity from liability for following standards of care.
All they have to say to you, or all the opposition's lawyer, Ascension Hospital's lawyer, has to say to you is, we followed standards of care for treating your daughter. Sorry. Right.
That's exactly what they did at the trial. So we had, our doctor expert, they brought in 5 doctor experts. Our expert said bluntly, I mean, these meds killed Grace. They didn't follow the standard of care, but there are 5 Johns Hopkins doctors, and 2 of them were from Johns Hopkins, and other prominent educated people, they said that they followed the standard of care. And it's not not that they're glad Grace was dead, but I mean, it just is, they did everything they're supposed to do.
And that's going to be such a winning argument with a jury, unfortunately.
Yeah. And it was, only 1 out of the 12 jury members sided with us.
Oh my gosh, how horrific. So what is the status of your lawsuit now? Are you appealing? What's the news? I see that there's a lot of news coverage of your litigation.
Yeah, I mean, I'm surprised at how fast the news picked up on it, because I did my formal announcement of it yesterday, but last week, Wednesday, I filed a motion for new trial, and that's not an appeal. So a motion for new trial goes back to the court that made the mistake. And so what the basis of this motion for new trial is the judge, this was happening behind the scenes.